1 in 11 adults has diabetes. Hi, my name is Dana Hildebrand, and I'm here to talk about the proper way to check your glucose level or your blood level. I have been diabetic since I was 2, so believe me, I have checked my sugars once or twice in my time. It is very important for people to understand the proper way to do it because they will avoid infections, and also just it's painful sometimes to keep pricking yourself. Who actually knows what a normal person's blood level should be? Not a lot, actually. Surprisingly enough, not that many Americans know what a normal blood sugar level is. A normal person's blood level should be anywhere from 80 to 120. This is a glucose monitor. This is used to read your blood sample to give you an accurate level of what your blood sugar or glucose level is. This is a Lancet device. This is what is used to prick your finger in order to get the blood to test. This is a Lancet. This is the needle that is used inside the Lancet device in order to be able to prick yourself, again, to get the blood sample. We're going to use a little test strip that is designed for the device or machine that you have. By inserting it, the machine will automatically turn on. Meanwhile, we are going to pop the top off of the Lancet device. We are going to insert the Lancet itself, push down till you hear that click. You're going to pop this little top off, and then there is your needle that is clean and ready to use. Every time you do your blood sugar, you are going to want to use a new Lancet just to be on the safe side and make sure that you're always inserting a clean needle into your skin. You're also going to use an alcohol swab. So before you prick your finger, you're going to want to use an alcohol swab to clean the surface area, so to make sure that it is a clean sample. Give it a little blow, because you don't want it to sting with the cold alcohol on it. You're going to do the prick in the corner of your finger. That usually provides the least amount of pain, and also it provides the most blood. Then once you do that, you're going to squeeze until you get a little sample of blood on your finger. Now, my device does not require a whole lot. Nowadays, the devices only require a little dab, where before they used to require quite a bit of blood. But you're going to insert that little drop of blood into the machine, and it takes about 5 seconds to accept and pop up with a reading. Meanwhile, you're going to want to take a tissue, a cotton swab, anything to stop the bleeding. 5 seconds later, and then your results will pop up on the screen. Now, don't mind mine. Mine say that it is above the normal, and that means that I have to give myself some insulin to correct that. Each and every time you do this, again, you're going to want to perform it the same way. You're going to want to use a clean Lancet, and you're also going to want to use an alcohol swab to prep the area. I think it is extremely important for every individual to know at least how to check their blood sugars, especially in my family. Even my 5-year-old son knows how to check my sugars, so that if anything happens to me, he is able to at least know whether or not my sugar is low or high, and if he needs to call somebody else for help. Thank you so much for listening. Take care.